Welcome Internet. Today we're going to be talking about Cotard syndrome, a very rare form of psychosis, a neurological condition which affects less than 200 people worldwide. So it's very, very rare, and I myself have never encountered someone with Cotard syndrome. However, I did really want to talk about it, so that's why I'm doing the video. So what is Cotard syndrome? Cotard syndrome is a form of psychosis which mixes certain elements of hypochondria, in which there is anxiety to do with the body. The person becomes convinced that some of the organs are absent or have been changed of state. For example, some, like the heart, might have become stone or sand. They might also feel that they are rotting inside, or that they have no eyes, they have no mouth, because how Cotard talked about it is that it was a délire de négation, meaning delirium of negation, in which the person denied, or at least was in the delusion of thinking that something was missing inside of themselves, or something on themselves. So fundamentally, that missing bit of themselves is something that they are convinced about. You can't reason them out of it. It's a true delusion. They also might be convinced that they are damned, that they have already died and they've been brought back, or their life has continued because of some evil, malevolent entity that brought them back to suffer. And suffer they do. Unfortunately, they are at very high risk of committing suicide. In France, it's believed that someone with Cotard syndrome has to absolutely get emergency treatment, as this syndrome can be disastrous, as a person to end their suffering might commit suicide. So you might feel, yes, but if they feel that they are themselves immortal or damned or have to continue, why would they commit suicide? Well, fundamentally, they commit suicide because of the suffering, and a part of them, I think, also is trying to fight against the delusion of immortality, of being damned. And it's also a way to self-punish, because as they feel that they're damned, they might feel that something is against them, or they've committed a sin or something terrible that they have to be punished for. So in a very, very broad way, it's a syndrome that creates a lot of suffering. There are 3 stages in this syndrome. The first stage is the germination stage, in which the delusion hasn't been completely open, is still bubbling inside, but the first signs are noticeable, like withdrawal, like certain strange ideas start occurring to the individual. Then there is the blooming, in which the symptoms start invading the psyche of the individual. They start becoming more and more present. For example, the heart really does become of stone. The eyes are really absent. The ears are no longer functioning. They're rotting inside. All of those things happen during that blooming stage. And then we have the third stage, the chronic stage, in which the illness is prevalent. It's there and it is established both in the psyche of the individual, but also manifests with others, and becomes very easily observable by an outside source. So what happens is that fundamentally in France, when someone triggers it, they need emergency care. That emergency care is, of course, medication, like for example antidepressants and antipsychotics, but it is also sometimes shock therapy, as seismotherapy has been proven to be somewhat effective in calming the symptoms or lessening them. So fundamentally, we don't really know if psychotherapy can help. The ideas my teachers, when I was taught about this syndrome, was that perhaps therapy can help them connect to another human and feel something again of humanity through the therapy, but it doesn't push away or compensate for the symptoms. The symptoms are still very much there, as would be in any forms of psychosis. And psychotherapy can't be the main treatment. What is the main treatment is the other sins and institutional care. I think that it can't be dealt with by one individual. It has to be dealt with an institution. So moving forward from that, what causes it? So there are, from my understanding, two to three types of triggering of this. Apparently, some people have it develop as like the wood schizophrenia, like this delusion starts slowly, like in a pre-morbid phase, and then it explodes, which would be coherent with the 3 stages of germination, blooming, and chronic, as a schizophrenia would be. And we have also, and this is also part of the high interest of this syndrome, is that apparently certain neurological problems can explain it. For example, one of the main examples is someone that had a bike accident in the 90s and had a head wound. And he started, after that head wound, developing Cotard syndrome. So what happened was that he had to live that experience of the accident, and he didn't have any form of psychosis apparently, and then he started having it. So what is fundamentally interesting is that we have started to understand that perhaps certain parts of the brain were affecting Cotard syndrome. What we now think, at least a prevalent hypothesis, is that it's the fusion gyrus, which is a part of the brain that's located both in the temporal and occipital lobes, which is apparently here. And I will link it in the description, like if you want an image of it. But the idea is that fundamentally these parts are partly responsible for Cotard, but they don't just do that when they dysfunction, because apparently they're involved in word recognition, face recognition, and dyslexia. So a whole range of things. And I know that part of the brain is something where the function is still very much disputed. Like, we aren't 100% sure, but apparently there is a link with Cotard syndrome. So we don't know if that's exactly the answer, but it might be part of the problem, right? Anyway, so coming back to the more psychological part of Cotard, what can be very important for those people is fundamentally to get the care they need, as the syndrome does not, it's chronic. It's something that won't self-resolve or self-actualize. So fundamentally, the person needs a lot of help. And when I mean that, I mean that the delusions can be so strong that, for example, so certain people might feel, because they're already dead or rotten inside, they no longer have a need to drink or eat. And it can go to the point of starvation or dehydration because they no longer sustain themselves. So Cotard is not an easy mental illness to treat. I would even dare to say it's one of the most complicated forms of psychosis, as the person is truly convinced of their deadness. In a way, what most people with Cotard say is that they're walking corpses. That in a way they no longer have an existence. What they have is mostly a presence in which they just are there, they're no longer alive. And that causes immense suffering, as their non-life is seen as punishment, as something that they, like something they have to go through, but something of pain. And perhaps if we were to use Winnicott's idea of true and false selves, perhaps they feel something is missing, something genuine and real that has prevented them from being fully alive. And the fact that that is missing creates a despair in which they want to just end things, and perhaps also in a desperate attempt to try and regain what has been lost. But this is a very psychoanalytic interpretation, and I want to stretch this. It's not necessarily a truth. It's really what, at least from the surface, I could inject to try and make something out of the symptoms. But I don't want it to be considered as a truth, but more as like an idea or a hypothesis. So that's pretty much it for this video. If you have other information, other things you want to ask, please feel free to do so in the comments. And I'll see you in the next one. Bye.